Okay, so we're doing panic disorder, and it's under the list of anxiety disorders. So remember that it's unpredictable, okay? So nothing happens beforehand that actually brings about the anxiety, such as like in a phobia. This is unpredictable, and it's recurrent, so it could happen several times a week, several times a month. It can go away and come back, but it happens again and again. It's not just a one-time thing. It usually lasts minutes. It rarely lasts hours or longer than that. And to qualify as a panic disorder, the patient must have 4 of these symptoms, which I will go over. And then usually these patients also have signs of depression. And the panic disorder can also be coupled up with agoraphobia. So the agoraphobia leads to the panic disorder, but we'll go over that further when we go into phobias. Okay, so signs and symptoms. The way that I remember it is imagine yourself in an elevator, and the elevator stops working, okay, and the lights go out, and the air turns off. Now you're starting to panic, right? And the building's empty. So maybe you feel dizzy and you feel lightheaded because you just heard the air shut off and you're a little bit freaked out, okay? This you feel like this can't even be real. So you have you have this experience where it's like depersonalization or derealization. You can't even believe this is actually happening. Okay, you're gonna fear dying, right? Because you're stuck in an elevator in an empty building and the lights have gone off and the air's been shut off. Okay, and you feel like you're losing control. Okay, you're freaked out, so you're gonna be sweating. You're gonna be trembling. You're gonna be short of breath. Okay, the air just got shut off. Yeah, you're gonna be a little short of breath. Okay, and the sensation of choking, and your heart's going to be beating really fast, and then you might even have a little bit of numbness like in your limbs, your hands and feet, and you're like, oh my god, I can't even believe this is going on. And then you might have chills, hot flashes. Okay, you might get really nervous and you feel nauseated, or maybe you even have some abdominal pain. Okay, so those are ways it helps me to remember. Just remember yourself stuck in an elevator, the lights have gone off, and the air just got shut off, and the building is empty. Okay, that's pretty freaky. So the goal for these patients is basically to teach them effective techniques as their anxiety increases, to be able to intervene and stop that emotion before it becomes a panic attack. Okay, so treatments. The patient can go to family or group therapy. Right, meeting other people like themselves can often help these patients, and then obviously family members are affected by this as well, and that can help the family member and the patient. Okay, psychotherapy. So usually this is like a one-on-one with a therapist, and the therapist basically helps the patient possibly understand maybe some unconscious reasons why this is happening, or understanding the primary and secondary gains of their anxiety possibly. So a primary gain would be like, let's say I have a headache, so I don't have to go see my mother-in-law. And so, well, I just have a primary gain. If I don't like her, I don't have to go see her. And a secondary gain would be like, oh, well, now I feel sick. My husband's going to baby me, and he's going to bring me food, and I get treated like a queen. So that's my secondary gain. So these are reasons why maybe certain people might hold on to these anxieties because of the gains that they get. Okay? So now cognitive therapy. So this is basically the cognitive therapists believe that some of these people basically kind of like started a routine of like dysfunctional thinking and exaggerated automatic thought to certain triggers. So usually this therapy will last between like 5 and 20 sessions, right? It's very organized, and the cognitive therapist will basically ask the patient a series of questions in hopes that maybe slowly the patient can see the fault in their thinking, and then come up with ways that are more healthy. Okay, so that's cognitive therapy. And then behavior therapy, things such as the desensitization and the implosion therapy. So more for post-traumatic stress disorder and possibly phobias, but the behavior therapist might teach the patients techniques of relaxation, whether it could be like breathing, imagery, exercise, something to calm the patient down when they're having these anxiety attacks, okay? Now medications. So I put the trade name, so basically, you know that Ativan and Xanax, Okay, so this is lorazepam, this is alprazolam, I think that's what that is. But basically, these are benzos, okay, and they help calm the patient down. Because of possibility of the patient becoming addicted, sometimes physicians will or psychiatrists will actually give Buspar. Okay, so Buspar is an anti-anxiety drug, and it works very well, especially with patients with generalized anxiety, even though we're talking about panic disorders right now. It's not addictive, and patients don't build a tolerance to it. Okay, so that's a very popular drug. So you know that it's not addictive. Patients don't build a tolerance to it. Okay, Buspar. It's an anti-anxiety drug, and it takes about 10 to 14 days to kick in. So you need to tell the patient that, right? Because they might expect the drug to kick in immediately. Okay, and then of course, as in all these drugs, do not take it with alcohol. Okay, so now we went through the benzos, we went through Buspar. Now we're going to go through the SSRIs. SSRIs, because of their limited side effects, are actually usually one of the first lines of drugs that the doctor may order. So I know Prozac, Zoloft, and Luvox are all approved for decreasing the symptoms of anxiety. Okay, so SSRIs, remember, those are the first line of defense drugs. Okay, and then antihypertensives such as propranolol or clonidine may also be prescribed to decrease the symptoms. But propranolol, for example, is much more effective in acute anxiety and helps the symptoms such as like palpitations or trembling. Okay, so propranolol is more for those type of symptoms, and then clonidine is really helpful with patients that are withdrawing from drugs and they're feeling the anxiety. Okay, so these propranolol and clonidine are both good, but they are more for acute anxiety, and they are not the first line. Okay, the first line is going to be your SSRIs such as Prozac, Zoloft, and Luvox. Okay, well, I hope this helps.